Hello everyone. Today we are going to discuss about RH incompatibility or regarding RH factor in the newborn baby or during pregnancy. So let's start. Starting with introduction. During pregnancy, the mother and the fetus have different RH protein factor, and this condition is called as RH incompatibility. During pregnancy, if the mother and fetus have different RH factor, then this condition is called as RH incompatibility. Like our blood type, we inherit our RH factor type from our parents. Most people are RH positive, but a small percentage of people are RH negative. What is this RH factor means? Suppose if your blood group is A positive, A is your blood group and positive is your RH factor. So most of the people have positive RH factor only. Only few percentage of people have RH negative factors. And RH factor does not directly affect the health. However, RH factor becomes important during the pregnancy. Why? That we will discuss now. RH disease. Rhesus disease is a condition where antibodies in a pregnant woman's blood destroy her baby's blood cell, and it also known as hemolytic disease of the fetus and the newborn. What happens in case of RH incompatibility? The mother antibodies will destroy the baby's blood cell. Why? If mother is positive or negative, okay, but baby is having different RH factor. Just example is mother is RH negative but baby is positive. So what happen? Mother body's antibodies think that baby is blood is a foreign body for them, so they will destroy the baby's blood cell. That is only RH incompatibility. If the mother is RH negative and her baby is RH positive during pregnancy, okay, and especially during labor and delivery, some of the fetus RH positive red blood cells may get into the mother bloodstream, okay. And sensitization, the process in which mother body will try to fight them off by producing antibody against them. Next, what happen? It can cause miscarriage, termination of pregnancy, antepartum hemorrhage, invasive prenatal testing, delivery, and ectopic pregnancy. Okay, see what happens. Some cases RH negative woman and RH positive man conceive a child. So in that case, there is a chance that negative mother also can carry a positive factor baby, or RH negative woman with RH positive fetus, or cell from the RH positive fetus enters into the woman bloodstream, or you can see women become sensitized antibodies from to fight RH positive blood cells. In the next RH positive pregnancy, maternal antibodies attack fetal red blood cells. So here are some condition in which cases there is a chance of having the RH incompatibility. Okay, the first one, what happen? If the husband is positive, mother is negative, there is a chance that baby can be positive. Second cases, what happen? Mother is negative and baby become positive. That is also one cases. Another cases, what happen? Mother is that cell from mother is negative and baby is positive. So from the baby it's entered to the mother body, so mother body will show the reaction. In another case, you can see the woman becomes sensitized antibodies from to fight RH positive blood cells that enters from the baby's bloodstream. Okay, so these are the some cases. So or this is how the RH incompatibility happen. Okay, one more time I'll repeat it. If husband is positive or mother is negative, okay, wife is negative, so there is a chance that mother can carry a positive baby. So the first picture, okay, this one. Second one, what happened? Mother is carrying a positive baby and mother is negative. So from the baby's blood, some blood will enter to the mother body, positive blood. Then the mother body will become sensitized against this bloodstream, okay, what is coming from the baby's body, and it will destroy the baby's blood. Okay, so this is about the RH incompatibility. Next is causes. First one is ectopic pregnancy. Okay, ectopic pregnancy means that pregnancy, that implantation of the embryo is not happen in the uterus, it is implantation occur other than the uterus, okay, like fallopian tube and all. Partial molar pregnancy, dilated ovum, antepartum bleeding, external version, platelet transfusion, placenta previa, placenta abruption, abdominal or pelvic trauma, in utero fetal death, any invasive obstetric procedure, lack of prenatal care, and postpartum RS positive baby or spontaneous abortion. Next is symptoms. The RH incompatibility can cause symptoms ranging from very mild to deadly, and in its mildest form, RH incompatibility causes the destruction of RBC, and there are no other defects. Okay, in the normal cases, after birth, the infant may have yellowing of the skin and the whitish of the eye. Okay, it like there is a chance of jaundice, low muscle tone, that is hypotonia, lethargy means tiredness, and swelling or edema, and the hydrops fetalis. So like normally these are the symptoms you can notice if there is a RH incompatibility. Next is diagnosis: MCF Doppler, cell-free DNA, Clay-Horner test, amniocentesis and telegraph, and direct com test. Next is screening test, that is ABO or RH antibody at first prenatal visit, means when the mother is pregnant or the wife conceived, the first time only they will go for this test. Okay, at 28 weeks, postpartum bleeding, antepartum bleeding, and before giving any immunoglobulin. Okay, so there is a one immunoglobulin which can prevent that RH incompatibility if it is found like earlier. Okay, which can prevent the any effect in the baby. Neonatal bloods, ABO or RH, or gold standard test like indirect comb test or direct comb test. So this is the example of direct comb test, what they will do through the help of agglutination test, like it is patient sample, okay, RBC, and NT immunoglobulin comb reagent, they will mix it. Example, the baby sample is positive for the presence of the mother antibodies on the surface of red blood cell in the erythroblastosis fetalis. This is theological test. Next is complication during the pregnancy or after the birth. During pregnancy, what happened? There is a chance of mild anemia, hyperbilirubinemia, and jaundice. And there is a chance of severe anemia with enlargement of liver and spleen and hydrops fetalis. That is the complication you can notice during pregnancy. Or after birth, you can see severe hyperbilirubinemia, jaundice, and kernicterus. Next is management. The management is NTD immunoglobulin. It's very important if it is found out in the earlier cases. So there will be given this NTD immunoglobulin, which will not allow the mother body to develop the antibody against the baby's bloodstream. Okay, and the fetal blood transfusion and phototherapy. And route of administration will be like for the transfusion, there will be into umbilical vein at the point of cord insertion, into intrahepatic vein, peritoneal cavity, or fetal heart. And transfused blood will be Rh negative, cross match with the maternal sample, Dancy fanked or hemoglobin around 30 grams per liter, white cell deplete and irradiated, screen for the infection including CMC. Okay. Next is prophylactic vaccine. During every pregnancy, after a miscarriage or abortion, after prenatal tests such as amniocentesis and chorionic villus biopsy, or after injury to the abdomen during the pregnancy. So with this we has completed RH incompatibility. So the simple thing is, if mother blood group or mother RH factor is positive or baby is negative, or mother is negative, baby is positive, then only it will be complicated. Okay, and it can affect in the babies. Okay, mainly baby can get anemia, jaundice. Okay, and sometimes it may be deadly also. Thank you everyone.